Well, hi, everybody, and welcome to another episode of our Continence Chat podcast. I'm here today with my wonderful Seni colleague, Suzi Fox, and another very special guest. I just love where we're going. Dr. Raj, welcome to our podcast. I'm going to just
thank you.
Yeah. I'm just going to share a little bit. I think a lot of people are already familiar with who you are and what you do. But for those that may not be, Dr. Raj is an MD. He is very impressive, quadruple board certified. 4. That's a lot. By the American Board of Internal Medicine. He specializes in internal med, pulmonology, critical care, and a topic that's very near and dear to us, sleep medicine. He also teaches residents who are getting prepared to take their boards. He's been on a number of different television shows, The Doctors, which people are familiar with, serving as a resource. I also want to dig in, Dr. Raj, a little bit to Sleepopolis, if I'm even pronouncing.
Oh, yeah, of course. You made them very happy just to mention their name. Okay, cool.
Awesome. And welcome. And maybe just as a way of getting started, I know that's your bio, but I've had the pleasure to speak with you now for a little bit. And I just think you've got an awesome way about putting content into layman's terms. And I just inspire your spirit. But maybe you could just share a little bit about what you're doing these days and your why behind your passion.
So my claim to fame is I'm just super nice. It is, you know what I mean? But you're right. In my pie about being a doctor, I try to be a good lung doctor in critical care. And for the longest time, I thought the only way to help people is to be an ICU doctor and putting them on vents and putting in catheters. And it's not that. I think the biggest thing that changed me is that my dad had Alzheimer's. I didn't even see it coming. I made so many errors, and as he got progressing through his disease. So now I think the best way to help people is palliative care and hospice and just being nice on the inside. But I do love teaching, and a big part of what I do is, writing, medical dorky textbooks and having dorky medical podcasts, just being a dork, you know what I mean? But yes, there's a huge part of me that just loves doing some TV media stuff. And that kind of happened by accident when I was at USC, University of Southern California. I got a call from the doctors, the TV show, last minute to go there. And I just couldn't believe it. That was my 5 minutes, but that led to another 60 episodes that led to other opportunities. And and right now I'm just really enjoying being the associate program director here at Huntington, where I got these really cool residents where I could mentor them to be better people.
I love that. All I can think of is your, sharing the educational component, and you're likable and you're kind. And I think with healthcare and even people looking for physicians, consumers are better educated. And so I tell me if I'm wrong, but I feel like over the years, we've gone from not knowing much about physicians, just that someone has the title of physician and we trust what they're saying and we do as we're told. But I think consumers now are looking for physicians that are more relatable, which to me, I can understand why your students and your viewers like you. So that's a compliment. But
thank you. I never stopped enjoying compliments. So that was a nice one. I love it.
So, wow. I'm curious where you do teach residents in terms of incontinence. Are there sessions about incontinence or courses, or how do doctors learn the educational side of incontinence?
Yeah, and well, I hate to throw myself under the bus because I write the curriculum for education. There isn't something about incontinence, and that's true. And I think that if there was going to be a group of doctors that should educate us, I'm going to blame the urologists, but I love them all, so don't get mad at me. Because anytime we think about getting urology involved, I can imagine as the patient that comes in, they come to the medical ICU or on the floor and they need a Foley catheter, which is a device that goes to the urethra, whether it's a woman or a man. And if we have trouble putting it in, then we get our urology buddies to come and help us. And they're always upset. They're like, I can't believe this. But I wish they would kind of embrace that, hey, we shouldn't only interact with, education and other attendings when it's like in the acute setting, you know what I mean? Where, oh my God, there's like pyelonephritis, I need to put in a stent, but show us what's practical. So we definitely need more education in that. And I really feel like what we were kind of mentioning off camera, people don't realize that incontinence actually integrates really well with dementia, with depression, with sleep, with how we manage heart failure because of meds. And I think that's why I wanted to come on your guys' podcast to let it know that incontinence is important. And by treating the incontinence and getting to the root cause, it can help other diseases and other disease states. And that's important.
Super important. I agree with you. Yeah. Go ahead, Suzi.
Quick question, Dr. Raj. When is it appropriate for someone to come and see you and seek out help?
I think it's the hardest part is that if it is something you're thinking about in the back of your mind, it's a time to at least get that conversation started. And I think that the hardest part right now in healthcare, I'm going broad, is that there's just no time. If you want to go see a doctor, your family practice, good luck. You know what I mean? Because where is our country going? It's going towards concierge. Because if you're not paying out of pocket to find your own personal doctor, you're not going to see him the next day. And I could speak for many healthcare systems. I love everyone I work for, but especially primary care doctors that do outpatient. I mean, an appointment, months from now? Then when you go there, you have to address 20,000 different things. If you're older in age, going with mom and dad, they got 20,000 different drugs they're on, but you should bring it up. Because, in speaking with you guys just a little bit off camera, there are some simple things we could do that could help out. And I don't think we know these simple things that we could do,
Yeah. Yeah. Are you finding that more people, I guess I'm going to ask all ages, are more proactive to stay well and healthy? Because there's been a big push globally to stay healthy as long as you can because of some of these ripple effects that are happening out there in healthcare. But have you found that? Are people proactive and listening to advice?
So I love that question because there's two things. There's health span and there's lifespan. You know what I mean? And we all want to live forever. We all want the fountain of youth. But sure, if you live forever, you'll get dementia and heart failure. If you're a guy, you got metastatic prostate disease. But if we could focus on health span and make sure they run parallel so you can live long and live healthy, yeah, that's great. And the way you really do that is what I call the pillars of health, which are going to be sleep and exercise, the appropriate diet, the appropriate weight. And there are ways to do that in a simple way. But unfortunately, of course, everyone wants the magic drug, the magic pill, the magic bullet. And there are medications out there that are now having so much press, I'll say it, all these GLP-1 agonists. Some brand names would be your Ozempics and Wegovy's. And even though they were kind of really discovered and created for type 2 diabetes, now it's for obesity, now it's for OSA, there's data about dementia, oh my God, I can't even keep track. But the problem with focusing on medications, only medications, not everyone can afford them. And it makes me sad, you know what I mean? Like, I want to do things that everyone could help with. And that's why, when we're talking off camera about incontinence, like little things that maybe putting mom or dad on the side of the bed closest to the bathroom, maybe buying a nightlight, maybe even not to, promote your own brands and stuff, but actually giving a little thought into when you purchase your, lack of a better term, a diaper, maybe one that doesn't give you a urinary tract infection all the time. And those are things that we don't know those things unless we have these conversations. And that can help out to a better health span.
Got it. That
Yep.
makes perfect sense. That makes perfect sense. I
Mhm.
wanted to dive a little bit deeper into
Yeah.
sleep medicine because I know
Sure.
that's one of your specialties. What would you share with viewers, one or two top things that come to mind of importance where sleep ties with health span?
Oh, so when we talk about what is good sleep, and it's hard to get, trust me, but I always think about the two cues of sleep. What are the two cues? You need the good quantity sleep and quality sleep. So quantity means how long is your sleep. And for most individuals, it's going to be around 7 to 9 hours, the sweet spot being around 8 hours, and of course, as we get older, getting good sleep is a pain in the butt. Why? Just naturally, we get less REM sleep, we get less deep sleep. We're on multiple medications. It takes longer to snooze off. You wake up all the time, plus other comorbidities that we have. So sleep is essential. You need that 7 to 9 hours when you get older, but it's hard to get. Quality sleep means that can you get to that deep stage? And as I mentioned already, you get less deep sleep as you get older, and you get REM sleep. And REM sleep, for your viewers, is a stage of sleep where you get those vivid HD TV-like dreams. And you need both to rejuvenate you mentally, physically, your cognitive skill, and especially in the elderly, even one night of poor sleep can really affect them the next day marching forward. So you got to focus on the two cues of sleep. I wish there was a magic bullet to say this is what you're going to do, but this is one of those things where you asked me, Suzi, should you bring up incontinence to your doctor? Right after incontinence, bring up sleep. I think it's just as important. And the other thing I want to bring up is going to be primary sleep disorders. And one sleep disorder I do want to bring up is obstructive sleep apnea. So just to give you some numbers, around 40 million people in the United States have OSA. In the world, it's almost 1 billion. And OSA is not just about, oh, my bed partner's snoring, let me give him the elbow right there. That OSA, you could sleep, that 7 to 9 hours, but because of multiple gasping and awakenings and arousals, because apnea means you're not getting airflow in and out of your lungs, no oxygen in, no carbon dioxide out, that you're always awakening and you're in those lighter stages of sleep. You never get to those essential stages. And untreated OSA can actually contribute to many cardiovascular problems such as atrial fibrillation and heart failure, poorly controlled diabetes, hypertension. But there are some other things that will tip me off to work them up that have nothing to do with the heart, the lungs, or sleep. And the answer is nocturia, frequent trips to the bathroom at night. And this kind of goes along with incontinence. It's different than what nocturia means, but there is that overlap. So maybe one of the things that we mentioned is that even as we get older, we still need to address our sleep issues. And as we get older, especially women, that's why I want to bring this up, is I got two beautiful women right here, is that after you hit menopause, women are pretty much at a higher risk of obstructive sleep apnea than men. Why? Because you lack that hormone, man, called estrogen. And estrogen gives you muscle tone. And when we talk about obstructive sleep apnea, it's not how big you are in the gut. It's going to be that how strong are your muscles in the back of your neck, in the back of your mouth, like tongue size and tonsils and uvula. So when you lose that estrogen, you lose muscle tone. So I think that we need to do a better job in women, in the elderly, making this diagnosis, and even something as incontinence could be related to obstructive sleep apnea.
Interesting.
Yeah,
Wow.
I thought you like that. I thought you liked that.
I like that a lot.
I'm also curious, what are some of the results of being sleep deprived?
Wow. So I always say, you name the organ, I'll tell you what happens. So when we talk about, having poor quantity and quality sleep at night, let's just talk about the heart. So let me ask both you ladies, what should happen to your heart rate and blood pressure when you fall asleep? Should it go up or go down?
Go down, I would think.
Yeah, Susie, you're like a med student, homegirl, you know? So you're right. So what happens at night is that your heart rate and blood pressure should go down because your heart needs a break. You know what I mean? You're sleeping. It's to rest our body. But if you are sleep deprived, you have insomnia, you have obstructive sleep apnea, what happens at night? Your heart pressure, your heart stays elevated, your heart rate is going to be elevated. And all of a sudden, your heart is working 24 hours a day. And that's why people with OSA are predisposed to heart failure and all these consequences. And then during the day, cognitive wise, people with obstructive sleep apnea, untreated, high risk of depression, definitely they have headaches during the day. They have mood changes during the day. There'll be a high risk of motor vehicle accidents. So for those who are older in age and still driving out there, you got to treat it. You know, and some of my patients, you're going to be kind of scary. I mean, those are the truck drivers out there. You know what I'm saying? They got diagnosed, you know?
Right.
Yeah.
Wow. How about Dr. Raj? We hear more and more about, and I'm not a light expert, but is there something to be said how different light tones nowadays can help people, and they should be more aware of lights in their rooms and colors to use and things like that would help some of that? Is that an easy fix?
Well, there is no easy fix when it comes to getting good sleep. You know what I mean? But, you know, I always say, you know, when you're talking about different lights, I'll dive deeper into it. I mean, it's using that compared to what? I'll have someone mess with the lights versus having to take Ambien every night. You know what I mean? And little things always could, you know, contribute in a positive way. But first, get down to the root problem, treat that. But if you want to talk about lights, so number one, what is my sleep hormone? It's melatonin. What actually regulates melatonin, regulates my circadian rhythm is light. So what happens in the morning when you get sunlight, like here in Southern California, that it suppresses the release of melatonin and you wake up. Then as, you know, nighttime approaches, it's going to get darker and dimmer. So now melatonin can be released. So with that being said, you definitely want to make sure you're out and about in the mornings if there's sun out there. And of course, at nighttime, you want to transition to sleep and not be in bright light situations. You know, when we talk about blue wavelength of light, blue light actually prevents melatonin from being released. So that's why we sometimes will have on our phones a blue light shade, blue light screen. And sometimes people wear these, I think in the 80s and 90s, these dorky orange big goggles to like block off the blue light. But what is the hot topic right now? And I'm not joking. Yesterday, I did a podcast on my podcast for someone who believes in red light therapy. Have you heard about it? So red light therapy, dude, you know, my daughter uses these word hacks. So this is one of the hip hacks out there is like red light therapy. And it was a woman, she's so cool. And she really believes about red light therapy. And it does have a lot of data behind it. And basically red light therapy is another waveform of light that in theory, it really penetrates, goes into the cells. Almost all our cells except red blood cells have something called a mitochondria. And what it does is actually encourage the mitochondria to make more ATP, which is the fuel for the body. And the more ATP you got, in theory, that regenerates things well, helps out with inflammation well. So she was talking about how red light therapy, and I'm being very broad about it, can help with weight loss, can help out with sleep, can help out with your eczema. So, of course, the jury, I think, in my opinion, is still a little bit out, you know, not all in just yet. But to go to your point, light is a hot topic. So I think that I'm glad we got to talk about it today.
Yeah. So interesting. Thank you.
Yeah.
Thank you. And what would you say? I know I was perusing your website and different articles. Am I pronouncing Sleepopolis? Am I even using that term? What's Sleepopolis? And I know it ties with information about sleep and mattresses and so forth, but for viewers that might be in need of a new mattress, if you could also, that's a part A and part B. What's Sleepopolis, and what are some things people should be looking for in terms of good mattresses?
Oh, great question. So actually the way this kind of fell into my lap is that, when I became like tiny little bit popular, people would ask me to do magazine quotes here and there, and it was tough, you know what I mean? And I think when you start off in life, do everything for free, because that's the way you do it to get your name out there and people trust you. But then after a while, I was like, wow, man, I do a lot of things for other people for free, And so what happened is that Sleepopolis, it was part of a bigger company that approached me to say, they're just going to take over a lot of the media that I do, and they actually will go through them, and it makes more sense. And they have an amazing team. And that's how I got kind of latched up with them. And Sleepopolis, actually, of all the different venues that I've been associated with, really actually does care about my opinion and about being medically accurate. And they don't put hocus pocus there, because that's my job for them, is to say, there's no evidence for this. This is BS. That sounds good. So I really wouldn't affiliate myself unless I feel we're both on the same page. With that being said, they are affiliated with a lot of mattress companies. And I'm not going to lie to you. They gave me the mattress on my own bed because I couldn't afford it, because I live in La Cañada. And like I said, my mortgage is too expensive. So my tip for everyone listening to this today is that, and this is actually what we talked about when you went on my podcast. We're talking about, how do you know if it's the perfect, lack of a better term, diaper stuff? How do you know it's the perfect mattress? I could try to wow people with all these different little scientific things, but it's really individualized. And I always say a mattress, of course, will be soft if an elephant jumps on it. And of course, the mattress will be very firm if a little mouse jumps on it. And if you go to the store and you just quickly, like you see in the movies, they jump on the bed, they do this. And I'm like, how are you supposed to know? You really have to sleep on it, lay down on it. And you are the best judge of what's a good bed. But with that being said, they taught me really cool stuff. They taught me that, when you get older, you want to make sure that the ends of the mattress are really more on the firmer side, so you don't slip off and fall off. If you sleep with a bed partner, you want to have technology that when they get off the bed, it doesn't ripple to your side of the bed. You know what I mean? Yeah. And definitely positioning makes a difference. You know what I mean? And definitely that, hey, if you're someone that snores, someone that has obstructive sleep apnea, someone that has heart failure, you may want to have an option where the bed can be kind of elevated in the head. If you're prone to swelling in your legs, you have lymphedema, lift up, elevate the legs a little bit. You know what I mean? And definitely little things can go a long way there. You know what I mean? So OSA, CHF, lift up the head. Swelling in the legs, lift up the legs, So little things make a difference. And I got to tell you, even though there's no data, and we talked about evidence-based medicine that says, hey, that mattress and that company will give you that sleep, it does make a difference to have your routine, your room, your bed. It does make a little difference. And I mean that. So when I finally got a nice mattress, man, I love it.
We're happy for you. Happy for you. Good for you, Dr. Raj. Wow. Well, we could probably talk another hour here, but I think we're coming up to our 30 minutes, and anything longer is not a chat on Continence Chat. So
I love this, dude. This is awesome. I can talk for another half an hour with you ladies.
Oh, we appreciate you so much, and your insight and your wisdom. If people want to reach out to you and learn more about the many different things that you're doing, what's the easiest way for them to reach you?
Oh, I love that. So I am on social media, so if I am kind of good at responding to stuff. So if you go on the Instagram, so I am Dr._Raj_. I'm definitely hanging out on LinkedIn for my old school posse. I'm in Facebook too. And for the young people that I'm trying to get into their world a little better, don't laugh at me because I see everyone laughing. I'm on TikTok. I don't dance on it, but I'm on there. You know what I mean? And let me give you two last websites. If you want only dorky medical stuff, medprep2go.com, only for dorky medicine. And check out my podcast too. Check it out. It's a Dr. Raj podcast.
Awesome. Thank you so much. We really appreciate it. This has been fun. Suzi, any parting words?
I'm just amazed to have time with a doctor that is so cheerful and smiling
Thanks.
all the time. So we appreciate you. Thank you.
You're very welcome. Thank you both.
Thanks a million. We appreciate it.